Well, welcome all of you. Anemia in women and anemia in pregnancy is one of the commonest conditions which has been seen by gynecologists and obstetricians all over, and particularly in country like India. Well, anemia may antedate pregnancy. It may be aggravated by pregnancy, and the accidents of labor perpetuate it. Decades, we, the healthcare provider, have tried to eradicate anemia in women and anemia in pregnancy by giving some oral formulations of iron, because iron deficiency anemia is by far one of the most important and a significant cause of all anemias put together. Well, although the investigations are very easy to diagnose iron deficiency, although the treatment is very simple, the paradox is that still we have a prevalence of anemia, particularly in pregnancy and more so in postpartum period. Well, the parenteral iron, when it came forward, it has a revolution in the management and tackling anemia, particularly in pregnancy as well as in non-pregnant women. We have seen the evolution of parenteral iron, starting from iron dextran, the first generation of parenteral iron, and seen the adversities and the anaphylaxis. And that's why we are fed up with this. Then the situation came, the era of iron sucrose, the intermediate complex, and where the molecular weight is less than the iron dextran, where the anaphylaxis is rarely seen, although we see some of the serious adverse reactions. And this has played a major role for a few years, particularly in tackling pregnancy and postpartum. I remember when the third generation came as the FCM, ferric carboxymaltose, which has a many advantages over the iron sucrose in terms of the various parameters when we consider about the osmolality, about the molecular weight, about the pH, about the stability, about the antigenicity, and more so about the benefit of single dose infusion in large dose up to about 1000 milligram in the single sitting, and least adverse effect. Almost I have never seen any major side effect, and I have compared with iron sucrose with ferric carboxymaltose, 6% with iron sucrose vis-a-vis 0.6% with the ferric carboxymaltose, and none of the cases I have seen a serious adverse reactions, and that has changed the philosophy of iron therapy, particularly in pregnancy as well as postpartum. There are two aspects, one is a therapeutic and another is a prophylactic. If the hemoglobin is less, you can give a therapeutic dose in postpartum period, whereas the new concept I have learned that yes, prophylactic. Believe me, we have started giving 1000 milligram of iron, parenteral iron, ferric carboxymaltose, and discharge the patient rather than writing for oral iron formulation for 3 months. Even in the discharge ticket, nobody takes. There are risks of GI disturbance, there are risks of compliant issues are there, and therefore I feel, and we all tried that in the postpartum period, before discharge from the hospital, injectable iron, particularly in form of a safe, effective iron like ferric carboxymaltose, has many beneficial effects. The sense of well-being following delivery and postpartum period, and the rise of hemoglobin, the rise of ferritin has been demonstrable. And this is really a unique way, not only in therapeutic but in preventive aspects for the well-being of the mother, particularly in the postpartum period. Thank you very much.